If you ever see practitioners doing this, that's what they're looking for, is the using the anterior superior iliac spines and then just comparing how this is all oriented. To start, I suggest trying to figure out which one of those points, if you look at my fingers right here, is lower. Okay, see how this one is lower down now? Now it's not perfect, people will surprise you, but typically that is the problem side. If you look, what it wants to do when it anterior tilts is it wants to out flare. So out flares out, in flare in. Anterior, like this. What that does is makes your butt kick out. Okay? Posterior, like this, that would be curled in. Now, what tends to happen though is this anterior with an out flare, look what that does to the SI joint. So here I am, then pinch, pinch. So that's the way it tends to jam. So how does this usually get interfaced with? Like chiropractors will use like a drop table to get that sacrum to shift. We can do some stuff. Now here's one interesting thing you can think about with pelvic stuff related to SI joint, okay? If it seems like, and we could just argue, hey, a lot of times people's SI joints tend to get jammed, especially if psoas is tight and they have that like this, okay? Side lying. So any pressure we put on the pelvis here in side lying is going to maybe open that space up a little bit. So I could either just make that my target, or a lot of times, and I'm usually standing on the other side of the table, I'd be finding that greater trochanter, and then coming in with my forearm. And a lot of things are gonna happen. There's a lot of pretty sensitive, these are thick muscles, but you'll find tender points in gluteus medius, gluteus minimus, tensor fascia lata. You'll find something there. So this tends to correlate well with, and all of those muscles are what are controlling the tension of IT band. So this is a way to affect the tone of IT band while also getting symptom reduction of all these. And then secondarily, maybe there's an effect on that pelvis too. So side lying, squash, it'll do a thing. In supine, the better tactic, now with all of this, we're not gonna go through a specific psoas release today, but remember that psoas, when it increases in tone, that's what it does. If it's fixed at the low back, it flexes the hip. If it's fixed at the hip and fires, it pulls the low back like this. It basically pulls the lumbar spine forward and brings the pelvis into an anterior tilt. So that's why a psoas check is a person lays there. If I can fit my hand underneath their low back, I know that psoas is tight, because that's what psoas do. Thus, this correlates well if there's a pelvic girdle shift. It's smart to do thorough work on the lateral side of the torso, quadratus lumborum, all of that, as well as to come in and reduce the tone of psoas. It's worthwhile always considering and doing, because it may be you assess the pelvis and it's all kinds of crooked. You do the psoas release, you reset them, and things are back to where they should be. So it can be one or the other. It can be also, instead of putting somebody through an aggressive psoas release, you could do the pelvic girdle stuff, and that may reduce the tone of it too. I tend to just do both pretty frequently. If somebody really couldn't tolerate the pressure here, then I defer to one. Stuff like that. All right. Thus, I tend to assume people are stuck like this. If I take them into a posterior tilt, that tends to do nice things for the lumbar spine. Somebody's stuck like this, bringing the pelvis back like this, tends to not only create space for the SI joint, the sacroiliac joint, but it reduces the level of stress on the lumbar discs. Go from here to there. So almost always a good thing, especially if we can just compare. And there's a few things we can compare with this, is the side of the pelvis that drops forward, that makes that leg longer. So if I take a person on table and I compare their leg length, if I see one leg is a little bit longer and I look at the pelvis and that side of the pelvis is down, then the puzzle pieces have come together. That needs to be taken up. Worst case scenario, just do both sides and hope that the reset happens. And all that's going to be is a person is laying supine. I'm going to use their leg and their hip. The only time I've had issues with being able to actually make this happen is if the hip joint has problems and bringing their leg up too far is really uncomfortable. But that ends up being all it is. I take this leg up so that I create a posterior tilt on this side. So I'm here like this, holding their leg, but holding the pelvis and that posterior tilt, this side of the pelvis. Now this side, we want them to engage. They can push their leg down into the table into extension. This is the same action we just did with the firing pattern with them laying prone. It's just going straight back. It can also be they just fire that glute, you know, the one side clench. When they do that, I'm holding this side pelvis up like that. When they engage that, they're doing this. So they're taking a structure from this, I'm forcing this one back, and then they're moving this one forward. And then I do that on the other side, and I hope it happens to set, and the body will tend to defer, ideally, to things being pulled back into alignment. When we engage the muscles around here, as those connective tissue elements feed even all the way down to the joints and the ligaments, it tends to pull things back into alignment. So if we do both sides, this tends to work out pretty good. And then afterward, doing the firing pattern sequence where we have them push their knees together and then pull their legs apart, that's a way to maybe confirm and get things to solidify there, because then we're having them do this and this. As an adjustment technique, don't mistake it for, because it looks just like it and it actually is just like it, called the shotgun technique, which is where practitioners are trying to get this to adjust and shift, the pubis symphysis. So when people push their knees together, a lot of times that does pop, and it's okay. All right? So that's all it tends to be. Now, do you want to be a demo or no?
Yeah.
Yeah, okay. So I'll have you pop up, come up here. We may not have time for all the practice on this one, but at least so I'll have your head that way, supine.
Supine.
Yep. Make sure. Yep, good. I'll bring you a little bit more in frame. Okay. Now, we'll bring knees up, feet flat. Then I want her to pick her pelvis up. So pick up, yep, down. That way, just so they're not laying crooked and you get a misread, okay? Then I can usually just follow their legs up, and it's hard to miss, okay? Now, there's a big belly, sometimes you gotta go under it, but it's fine. You just go up, you really can't miss. You find those anterior superior iliac spines, and then we'll see what we see. So I try to just draw a line. Always walk around. You're standing crooked, okay? Always walk around and assess it again and confirm. Then the other thing I could confirm, bring these down nice and slow. And it's a little bit subtle. What we have to do is compare the malleoli. So you have to be careful not to sometimes always just use the bottoms of the feet, especially shoes. Like one shoe could be slightly pulled off and that'll mess you up. So grab the malleoli. And it's subtle. It's subtle. If anybody wants to come up, they can. But this leg, yeah, see how this finger's a little bit lower down? This side of the pelvis. I draw a line. So she's just about that much off, and the correlation is there.
So
Now,
you're saying right side or left side?
left side is anteriorly tipped. Which side of your low back tends to be more of an issue?
I think the right side.
Well, that didn't correlate with my story now, did it?
Diagonal.
But we might as well do both, okay? So, all this looks like, and I'm gonna do the unaffected side first. And if anything, what I tend to do is I'll just do more correction over here. But you might as well do both no matter what. It's always gonna be good for the SI joint and for the lumbar vertebrae. So, relax. And clothing is tougher. This is where you have to do the contour drape, really get them lassoed and all that. Where loose fitting shorts are more preferential. So now what I have to watch out for in terms of safety is as I take the hip up to end range flexion, that it doesn't cause a pinching sensation in the hip joint. That's the only thing that sometimes can limit your ability to do this with people. So now what I look for, see when that pelvis just starts to lift up? That's when I know I'm truly at end range, okay? No pinch. Hip, is your hip okay?
Okay.
Yep, okay, good. Now, I want you to push this leg down to the table, and if you can, really try to get that gluteus maximus. Yes. And can you see how that already shifted? Okay. Now, slowly let go. Now, that's profound. So if you really watch me closely, push. I feel her pushing back against me. Slowly let go. And I go a few millimeters. And again. And slowly let go. Now this will be different than what maybe PTs are shown, where they'll use having a person really engage their glutes in a different way to get a similar result.
Yes.
Push down. This is the one thing I can feel good about kind of inventing. It's my simplified version of a lot of the pelvic girdle stuff. After having mom, a bunch of athletic trainers, physical therapists, and osteopaths, this is what I was able to dilute it down to what was easiest for me and easiest for them. One more. And good, nice and slow, relax. And wow. Now, what's cool is we didn't just get that pelvis to shift, I also increased the tone of that glute, right? And back down. That was the unaffected side, so we have to do more on this side. Oh, go ahead and scoot just a little bit towards me. Good. Okay, try to relax. Okay, let's watch hand here. Good. All right, and I'm searching for up there. Okay, and same thing but this side. And there's way more of a pushback against me right now. Slowly let go. You might have to move the hand, yeah. Put your hand right in the way. Okay, again, yep. Usually it feels good. Should feel like it's doing something.
Yeah. It's good sensation.
Mm-hmm. Will feel like it's giving that low back a good stretch. Let go. This one's going a little bit easier, yeah. Nice and easy. Okay, again, hold, hold, hold. Hold, hold, hold. Let go, nice and slow. Okay, one more.
Hold.
And slowly let go. Okay. Now I was a little bit, I pushed more there just because that was the side. Okay, now we'll both knees up again. Pick up and down. And I look. And try not to let confirmation bias get you. But I feel pretty good about it. So now we're right back there. You can do all kinds of additional assessments and things to confirm, but that's just using the malleoli for the leg length. And then all that stuff. And the last thing I would sprinkle in with this, and in terms of your firing pattern, stuff that we practiced, something that does fit in really nicely with the massage that isn't just, you know, all of that, is the adduction, abduction stuff. Because if we end the session with that, what we're saying to the body is we're increasing the tone of the balance muscles. And maybe we get the pelvis to shift a little bit on top of it. So it's a simple thing that doesn't make you have to do all that stuff, but I encourage trying to still keep that in practice so that you don't forget it. But if you take one away from you to incorporate more often, it's this one. But it's gonna be legs a little further apart. Okay, push hands together. We can do a little bit of stuff with the head too. Adductors and flexors are a bit more correlated. So if chin down, okay, push your knees together, good and strong. That was me, that wasn't her. So pull apart, head back, pull apart. Good. Push together, chin down, push together. Good. Pull, head back, pull. And last one, push, push. The pop doesn't have to happen. Good. But now we've left the body, and this could be, now if we did a lot of deep release work, pelvic girdle stuff, all of that, you should do this anyway, because it's a way to, I know at least the pubic symphysis is fine. It didn't need to pop, but I might as well confirm that that's something. I'm never seeking to actually make it pop, but I'm confirming that the pelvis is strong and solid. And this is everything from even people on blood thinners or anything else you can think of where you're worried they could be dizzy and stuff at the end of the session. Like they've already relaxed, this kind of way to wake them up, get their balance muscles going, make them less dizzy or have a tendency towards being dizzy, and then there you go.